Let's continue to look at the impact of COVID-19 on healthcare workers. Emergency physician Dr. Victoria Stephen joins me via Skype, and spokesperson for the South African Medical Association Trade Unions, Dr. Cedric Sihlangu. Thank you so much for your time to both of you. Let's maybe just start with you, Victoria. A practicing physician, you've seen what's happened this past year, and just an overview of how healthcare workers are dealing with the second wave.
Thank you so much. It has been an incredibly stressful year. The first wave came upon us during winter. It brought us under huge pressure with regards to the number of cases that we were seeing, the severe illnesses that we were having to treat, as well as the healthcare workers getting sick themselves, some of whom got admitted with severe COVID pneumonia, some of whom also died. Then we had very little respite because the second wave came upon us, with the Eastern Cape being affected first and the other major provinces being affected later. So what we are experiencing now are incredibly exhausted healthcare workers. Some of them are really afraid of getting COVID-19 for a second time, as we have noted that immunity is not fully guaranteed. We have just been under immense pressure, and for sure the surge has been upon our departments, and this has been incredibly stressful for us to deal with.
Another stress, and Cedric, maybe you can come in here, is the education around understanding the second wave and how it spreads and how it affects the body when someone has been affected. There are unions who've complained that healthcare workers across the country have not been given the adequate training as well as the education to understand how to deal with the second wave and the new variant that's come out subsequently. What would your thoughts on that be?
Thank you for the opportunity. Look, if you really were to sit down and analyze the situation in the country right now, I think everybody's worried. All healthcare workers are afraid. We actually don't know what we're dealing with. So you can imagine if you were to wake up every morning to go and face something that you yourself feel ill-equipped to deal with. It's quite a strenuous thing. Now, indeed, one would have expected us to have learned from, the first wave that we'd be more confident, but that is not the case. In fact, what is happening at the moment is you find healthcare workers that are not using adequate PPE. Insofar as the proper usage of the PPE, we've seen many instances where we are given these N95 masks, which are not really properly fitting and so forth. So those are the issues that health workers are currently still dealing with, despite there being over now 10 months of this COVID-19. We're still really struggling with that. But critically as well, what you're realizing now is that if we started a war with 100 soldiers and we are left with half of those number of soldiers, we're actually feeling slightly defeated as a workforce and as soldiers on the forefront. So certainly we as a union for doctors and representing healthcare workers are significantly concerned with regards to what's happening now in the country.
Right. And I think the important thing that would come in quite nicely here is the fact that we are going to be, there's talk about this vaccine and it's supposed to be coming to South Africa. Victoria, we are seeing that it's a little bit more delayed than it is in the rest of the world. European countries already vaccinating their populations. We haven't seen that here. Before we get to the reason for the delay, Victoria, who would have to be targeted when it finally does arrive? Obviously, healthcare workers would be at front and center, but how would it then filter through?
So as you said, healthcare workers do need to be prioritized because our risk of infection is higher than the general population due to the number of cases that we are exposed to, as well as the risk of increased severity of infection due to the actual viral load that we are exposed to on a daily basis. Then following healthcare workers, it should be essential workers who keep the country functioning, such as the police. And then it would also be patients who are vulnerable, who are at higher risk of severe COVID-19, such as the elderly and those with comorbidities that are known to increase the risk of severe COVID-19, like diabetes.
Right, and then another important thing when we're talking about the vaccine is the fact that a lot of people are afraid of it and don't trust these vaccines, and there needs to be an understanding and a great level of education, Cedric, that it is what's going to be needed so that we can curb the surge and the wave of COVID-19.
Absolutely. You know, the reality is, in fact, when we talk about modern medicine today, most of the interventions that we do are highly driven by evidence-based medicine. You know, the medication that you get in the hospital is highly assessed, you know, and really it's efficacious for, you know, for the diseases that we treat. So it's very unfortunate when we do see people from time to time making regrettable comments about, you know, the medications that we as modern medicine practitioners, you know, give to our people. And such is the case with the vaccine. We've got to trust the science that we've studied for many years to deliver good, adequate health to our people. And certainly would be advocates for giving this vaccine, giving it to the vulnerable, giving it to healthcare workers as a priority and extending from there. But certainly we are strong on the view that we've been practicing modern medicine for many years, and the vaccine as well is something that we would stand behind and advocate as part of what we do as health practitioners.
Yeah, now, Victoria, there have been a lot of excuses to come from authorities around this vaccine. I mentioned it briefly earlier. They say it's too expensive. There are delays in having it delivered into South Africa. I mean, why are we seeing this? I've seen that you've been a big advocate of getting the vaccine in as soon as possible. But with all these excuses and all this noise, we really don't know where to look and what to expect in the coming weeks or months.
Yes, it's incredibly discouraging for healthcare workers who are facing the second wave currently, who are working extremely hard. We are daily facing this infection, the risk that we are carrying to our families, and seeing the critically ill on a daily basis. So we have found it incredibly disappointing to hear certain comments from a National Department of Health. We have heard that the government would prefer to wait for the single-dose vaccine, which is only going to be ready mid-2021. And I understand some of the rationale for waiting for a single dose. A single dose is cheaper and requires patients to only come to the hospital once for a vaccine rather than a second dose. But this type of decision-making should not be based on healthcare workers who have a higher risk of infection and are actually part of the healthcare system. We need to get the vaccine as soon as possible. We cannot be waiting until June 2021 with the rest of the country because we are facing the second wave now. We need to ensure that the vaccine is provided via SAPRA and via EndureH to our healthcare workers far sooner than mid-2021. We have healthcare workers who have comorbidities. We have healthcare workers who got COVID-19 severely the first time around. We cannot afford as a country to lose more healthcare workers, whether that be through death or whether that be through resignation or immigration to another country where the vaccination is offered and where COVID-19 is under control. Every single healthcare worker in this country matters, and we need to get the vaccine as soon as possible. The 2 doses of which the government is concerned about importing into the country due to cost about $42 per 2 doses. So that would be the Pfizer vaccine that I am quoting. So if you need to compare giving a $42 medication to a healthcare worker versus them actually getting sick, spending 10 days at home because they have COVID-19 and can't work, versus them actually getting admitted, being off sick for months, or even dying. We know that it costs hundreds of thousands of rands to train a single doctor in this country. And I think that the health economics should be studied much more carefully. Healthcare workers should be treated as a separate category, and I really do feel that the vaccine should be provided to us much sooner than mid-2021.
And Cedric, while we do wait for this vaccine to hit our shores, what do you, in your opinion and your engagement with your colleagues in the industry, think should be coming from government in the meantime to deal with the second wave, just to make sure that you've mentioned that workers have been discouraged, just to boost the morale, just to make sure that they're working to their best of their abilities and the resources are there while we wait for that vaccine?
Thank you. Look, firstly, I think we should start here. The President announced a 5-level COVID-19 alert system. Now, that system basically was a risk-adjusted approach, guided by several criteria to determine at what level should we at any given time. But critical to that was the notion of transmission rate in the community, in society, of the virus. Now, we know when we were purportedly at level 5, at the time we were at the highest level of transmissibility of the virus. We had gone down a significant number of levels up until we got to level 1, where most normal activity had resumed. But you and I, Rufio, know now that we are sitting at over 14,000 cases in a day that are testing positive. Now, surely, this is even higher than the first wave, but we cannot be still on level 1. It's irrational because we've already had a system in place that says it will guide us, navigate around the level of transmissibility, and we'll know where we should be. So we really plead with the presidency to say, look, one of the critical things that's affecting us now as colleagues and doctors in the hospitals is the amount of trauma and casualty patients that we see competing for the same beds, the same resources as critically ill COVID-19 patients. I'll give you an example, not only with the ICU story. The same patient that needs an X-ray complaining of COVID-19 symptoms will be no different from another patient who's stabbed who also needs the same X-ray. So now you have patients crowding in this X-rays department waiting for the same X-ray to be done. Now we're saying that can't be allowed to continue. At the very least, we need to decisively deal with the issue of the alcohol now, before it's too late.
But Cedric, what about those who have argued that shutting down industries like the alcohol and hospitality cripples the economy, and crippling the economy would have far wider reaching effects than a burdened hospital system for a short to medium period of time?
It's a risk-benefit analysis, and unfortunately, that's the type of decision that the president is unfortunately faced with. But in reality, if you're just to go through the gazetted, the government gazette insofar as the regulations themselves, the alert level regulations, they're quite clear on what should happen when. And indeed, one would have thought that those regulations were put together, having it applied, the mind of the command council to say, if we are in this stage, this is what we need to do, and obviously considering the economy. But we know that we can't just simply come up with regulations, and when it suits us, we almost put them on the side and we forget that they're there to guide us. And that's what we are saying as Smart, to say the guidelines are there, so why should we neglect or fail to recognize where they're guiding us at the current moment? Because they say in high transmissible level in the community, you need to go to level 4 or 5. That's what the guidelines say.
Right. I mean, you are nodding your head vigorously, Victoria, agreeing with most of what Cedric has had to say. So I need to maybe get your thoughts on what government should be doing more to alleviate the pressures that we've seen, pressures that are going to be increasing significantly over the next few weeks.
I think we'd really like to see better policing and better, governmental control. So if you put the regulations out there and you change them, just where it matters, in our communities that are, where the trauma patients are coming from, this is where we need actual assistance and we need better policing and monitoring on the ground. That's my opinion. At this time of the year, generally in December, we don't have many medical patients. That's the normal type of experience that we have. And that allows us to some degree to manage trauma patients because we focus all our resources on them. But this year is a different year. We have a lot of COVID-19 patients who are crowding our emergency departments, and we are unable to give the same attention to our trauma patients like we normally are able to. So I do think that the regulations need to be looked at to get us through this end of December period where our trauma levels are very high. And it is all alcohol driven. So the alcohol industry does need to be looked at. Our dependence on alcohol, the amount of alcohol abuse in the country, needs to be taken seriously by government. Yes, we can say that the economy benefits from alcohol, but the economy also loses from alcohol due to the number of injuries, permanent disabilities that we see on a daily basis in South Africa. It's really not normal.
Sure. Victoria, Cedric, many thanks for your time this evening. I've been speaking there to emergency physician Dr. Victoria Stephen and spokesperson for the South African Medical Association Trade Unions, Dr. Cedric Sihlangu.